So if you've been told you have a disc bulge, that often comes from an MRI. That's really the only way to tell you have a disc bulge. You can have a reduction in disc height that you can see from an x-ray, but an MRI will tell you if that disc is starting to move posterior and off to the side or back and off to the side toward the nerve. It is worth noting that if you're over the age of 20, near the 30s, that it is common to have L5-S1 or L4-L5 disc bulge with no symptoms. It's like aging, it's wrinkles on the inside, and that they do happen without any reason, without any trauma, or without any explanation. Knowing that, though, it doesn't mean that's not what's causing your discomfort, but it is very common, and that oftentimes 99% of the time is that people have it and don't even know it, and it's not causing pain. And when I'm working with my patients, they've been told they have that, let's say, L5-S1 herniation. They want to know, when is it better? Well, there was this really cool study done that looked at spontaneous regression of disc herniations. And so they looked at, okay, if we did nothing over time, do people get better? And what they found is about at that year mark, people with severe disc herniations got better and the body reabsorbed that without any issues. That is not necessarily true about disc bulges. And so disc bulges are your body doesn't recognize them as harm, and so they don't really spend a lot of time trying to push the material back or reabsorb the material because there is some give there. You're built with natural space in there, so if you do have a disc bulge, it most likely doesn't cause any symptoms. And that's what we see in people. They can have tons of disc bulges with little or no symptoms, and that can apply for your neck too. So when I'm working with my clients, I really try to convey to them that, hey, like, you have this disc bulge. Let's say that today you feel awful, and then yesterday you were feeling pretty good. There was no change in your disc in that short of time, but it's based off of your symptoms and your movement. Typically what happens is that people, when they have a disc bulge or pain for greater than 3 months or so, is that they move differently during that time, and that different movement results in weakened muscles. And so what happens when you move less is that your body puts fat into the muscles, and those muscles their firing rate reduces. The recruitment of those muscles are reduced. So if you try to move and you're not recruiting the right muscles or encouraging the muscles at that time and the right muscles to fire, that's when you have discomfort. And so it's not typically the disc bulge that causes pain, but it's the related things that come along with it. But how do people know that they're better? Well, their movement is better. So the one thing that I look for in working with my patients who have a disc bulge is, have they regained full movement, full lumbar extension, and full lumbar flexion. So what that means is the ability to stand up and bend backwards and regain that extension actively, be able to lay on their belly, press all the way up, get the belly off the table and regain extension passively, and then regain flexion, be able to bend over and reach towards your toes. Not everybody has the flexibility for that, but can they reach towards the toes? And then how do those movements work? How's the fear level with those movements, and how's the quality of movements? And so if you're able to do that, that tells me, okay, now we're ready to really start loading things up and regain the strength throughout that range of motion. The second thing that I'm looking for is, how does the strength look through that range? And so can you do a mini squat? Can you do a full squat? Can you do a deep squat? Can you do a lunge? And that tells me, okay, can you do the things that disc is kind of resisting or encouraging? The responsibilities of that disc, do you have the strength through that? And then that's how I know that they're ready to do the things that they want to do. Typically that whole process takes maybe 4 to 6 weeks to regain that full range of motion, full strength. And so when I'm working with my patients, they want to know, how do I know my disc is better? Well, you really don't ever find out if your disc is better. It's based off of your movement, because you probably had that disc bulge for a long time and didn't care because you felt well. And so the only way to truly know is to do another MRI, but no one does that because it's a waste of time and money. If you have the range of motion and you have the strength, you don't really care what the MRI shows. That's the truth. And so when I'm working with my patients, they want to know if their disc bulge is better. It is better because you prove it's better. You regain the full range of motion. You can regain the strength by doing a progressive exercise program that's safe and effective for your back. And then you have the range of motion and strength to do the things that you want to do in your life. So that's how you know it's better. If you go to lift something up again and challenge the back, you can absolutely do that. I've had a severe herniation and I can do all those movements now. I've had plenty of patients who've had herniations and disc bulges and regained full range of motion and full movement. And so it's not, when you're thinking about disc and is it better and bending over again, it's not really based on time. It's based on movement. It's based on how you feel. So if that resonated with any of you guys, please let me know. I think it's good to know that information. I'm not downplaying that you're not feeling great or having back discomfort, but what I am saying is that a disc bulge is going to get better. It will get better. You just got to earn that movement, and a lot of times it's more related to the movement patterns and the muscles than it is actually the disc itself. And so I hope you guys find that information useful. Leave any more questions underneath the comments or in the comments. I really appreciate those questions because it helps me kind of put this information out there so you guys can get a little more from it. So as always, guys, stay healthy, keep moving, and take care of yourself.